Hi, I'm Dr. Sanil Nigalye, and I'm here with Kevin Johnson, who is a practice management consultant that I work with. He's also a coach for over 20 years. I'm an oral surgeon who's been in the community for about 14 years now in private practice. And I wanted to put this video together in order to share some information about what we're doing in our practice, specifically around implant therapy and full arch therapy. This has been sort of a hot topic for several years, and it's gaining more and more traction here in the Buffalo area. And as a result of that, we're going to be getting there's going to be some marketing in the area by other brands, national brands. I don't know if anybody here has heard of Clear Choice Dental, but they're a national brand where all they do is full arch treatment. And we want to be able to create something and educate our referring doctors and their offices and their teams so that we can have the conversations that we need to with patients, so we can offer the same sort of services. I think that we're well equipped to do that. I think that we're that certainly everybody's educated enough to do it. We just have to sort of put all the pieces together in order to make that happen. So the point here of having Kevin Johnson here is he's going to be sort of prompting me with some questions that you may have, things that you may be thinking about, like what is an implant? How does it work? How's this kind of technology going to help our patients? So I'm going to turn it over to Kevin to kick it off.
Thank you, Dr. Nigalye. So it's interesting, a couple of points that you brought up in that, there are a lot of questions, and it's interesting how, I'm sure a lot of the people listening to this, they've seen the full arch cases and they've seen other things, which in my book, a lot of these types of cases, whether it's full arch all restorative, or it's also including a surgical component, for a lot of these patients, it's like plastic surgery. It's like when you have years worth of something that has occurred, it's like our appearance may not be what we want it to be, and we're making major changes all at one time. And for a lot of these patients, it's really life-changing. But I think the big thing for the surgical, and more importantly, the dental practices, is we need to be able to have those conversations and know when to have them and what we're supposed to say. So I think really one of the biggest things that I would say most practices, and I think when you and I talked about this, one of the things that you and I talked about, which would be, again, most important, is just who's an implant candidate. Like if a patient is sitting in a hygiene chair, or they're sitting in a doctor's chair for a new patient visit, who, generally speaking, would be an implant candidate?
Sure, that's a great question. Sort of an easy answer. Really, the answer is just about any patient is a great candidate for an implant. Obviously, there are probably some anatomical things, or maybe some factors in patient's medical history that may make it maybe just a little bit more difficult to get from point A to point B. But to be very honest with you, those risks associated with those kinds of patients are quite rare. So, I would tell you that just about any patient is a candidate for some sort of implant treatment. The type of patient that we may send for evaluation, for a periodontal evaluation, if they've got rampant periodontal disease or something that's manageable, we may have them see a periodontist first before we embark on implant treatment, just to make sure things are as optimized as possible. But I would say just about every single patient is a candidate for some sort of implant treatment.
And it's one of my favorite phrases or concepts is outcomes and activities. And really the outcome being we're going to replace a tooth or an entire arch of missing teeth. And really, it's just a matter of the activities of how we get there. And, and it may be that, yeah, we need, you may need to raise the floor of the sinus, or you may need to graft the arch to add more bone or something. But ultimately, if this is the ideal treatment choice, pretty sure you and the dentist can work that out.
For sure. Yeah. And it's really, it's really a very transformational experience for patients, almost no matter what we do. I mean, anything from I've had patients go completely bonkers over getting even a single implant, believe it or not, even a single second molar implant. Just having that ability back to be able to chew the way they're used to doing either a full arch fix or a full arch removable. I mean, I would tell you that is probably the single most rewarding thing about implant dentistry is how it's transformational. We don't do the restoration part. The general dentists that we work with do the restoration part, so I'm sure that they are able to enjoy that aspect as well.
Absolutely. So, and we kind of dipped our toe in the pool there, in the sense of, like, we got into a little detail with this. And really, I think the whole point of that is that if this is a good viable option for the patient, for most of them, we can find a way to make it work for them. But I think the next thing, which is even more important, is, do we need to go into all that detail? Like, what should we say to the patient if this is an option, or they express interest in a dental implant or a full arch? What should we say to them while they're still sitting in the chair?
Sure. So it's really important to delineate what type of treatment the patient is looking for, to identify what that is. Whether it's a single tooth, that's relatively straightforward. The complexity, a little bit of the complexity really shows up where the patient is requiring a full arch of treatment. And so we have to, sort of to my point earlier, because, we're going to be having these patients are going to be knowledgeable when they're coming in. They're going to be asking a lot of these questions themselves. They're going to be saying, well, what are my options for full arch? I don't like my smile. I know I need to have all my teeth extracted. And they're going to be coming in asking questions like, what are my options for restoration? And I think us being able to have those conversations, talking to them about a removable option versus a fixed option, are going to be important. Some of these companies, their whole product line is a fixed option. So if we don't start having those conversations, we're gonna lose out on that segment of the market. And ultimately being able to keep our patients happy or deliver what they're looking for. So identifying whether it's a removable option they're looking for or a fixed option they're looking for, because they're both quite different. If they're looking for a removable option, there's just a little bit less legwork on the clinical side. A fixed option has a little bit more legwork on the clinical side. So if we can get that information at the get-go, that definitely helps streamline the process. Sometimes patients don't really know. They don't know the difference. And so, one of the things our office is doing is we're going around doing lunch and learns, and we're dropping off little models of what, at least what a removable, prosthetic will look like. And so patients can actually hold it. They can touch it. They can feel it. It's sort of like, you wouldn't make a large investment in something unless you actually had an idea of what that looked like and felt like. Right. So that's, I know I'm sort of jumping ahead to one of the questions, but I think that it kind of fits in there, is that, we're able to, give patients those kinds of things so that they can make a more informed decision.
And you brought up something else that you kind of flirted with it, I guess, but you said and as you're talking about that, you have one person there who's dedicated to making sure that the implant patients are educated. We communicate with them, you coordinate, and her name's Erica. And, it's awesome that you have someone like that there, that she's basically an implant concierge.
Yeah, I mean, she's been my implant treatment coordinator slash patient advocate for a couple of years now, 2, 3 years. I mean, she's been with me for more longer than that, but we sort of transitioned her into that, and she's really great. We've got her trained, to talk to patients about probably one of the biggest topics, which is financing and cost. I mean, that's the biggest thing. Patients always want to know that ahead of time, and we address those issues head on. So yeah, when I say we, I really mean Erica. She's kind of the secret weapon behind the scenes that is critical to this effort. And it becomes a matter of not if the patient wants it or needs it, because we all know that patients need it, and most of the time they want it. It's how are they going to get it? And so that part of it is really kind of where Erica comes in, and she works with them on various aspects of financing, or even influencing them in a way that they're able to move forward. Sometimes patients are very paralyzed when the process seems daunting in front of them. So we try to break it down and be their guide and take them from point A to point B. And that's what we want to do for our general dental referring offices as well. We kind of want to be your guide, because we've done this several times, and we know how it works, and we kind of know what the pitfalls are. We know what the challenges are. And part of making this video is to help the general dentist and their team be comfortable with working with our office.
So, and that brings us to the next point, which is, if they know who the candidates are, they know what they can say to the patient, what happens once they call your office? Because I think there's in many practices, I'll just say they may not want to bet their lunch money on exactly what happens to that patient once they leave their practice. That time frame between when they leave and the time they come back for the restoration, they may have no idea what really happened. So, like in a short 2-minute elevator spiel here, what really happens to that patient once they call your office?
Sure. When they call our office, generally they're going to get, if it's an implant patient or a patient that's calling for implants, they're going to get sent to Erica, who's going to be able to talk to them in an appropriate manner, and about specifically what their concerns are. She's going to let them know what kind of information we're going to need, what kind of clinical information, what kind of, obviously what kind of forms they're going to need in our office. We're going to send them all those things via email. There's some, if they're unsure about the process, whether it's a single implant or a full arch, we'll send them some videos that we have access to, so it helps them understand what the process is even before they come into their office. And then she's also going to talk to them about costs and what kind of investment they're looking at. So these are the things, the initial parts of it that I think patients are really looking for when they call. On top of that, they're going to get an invitation for a consultation to meet with me. And the consultations are about an hour long. We'll take a scan if we need to, a CT scan. I'll talk to them about general risks and benefits of the procedure they're going to have, or if whatever it is that they need. And once I'm done with my part, Erica will talk to them about all of the other aspects, such as what the cost for the treatment's going to be, what our schedules look like, what's the timing going to be for all the procedures, whether or not they want to have this done under local anesthesia or general anesthesia. And then if they're ready to move forward, we get them scheduled and we move forward. So it's actually a pretty seamless process, to be very honest with you, because we've done it so many times. So yeah.
Yeah, that's awesome. So, and you kind of you guys do a lot to connect the dots for the patients, and you do a lot to connect the dots to include the restorative dentists as well. And you somewhat alluded to the fact that you've done this a lot, and I know, this because I've been out on your YouTube channel as well, and you have like a number of success stories or happy testimonial patients that were implant patients, in addition to some of your more recent funny ones that are like your I think your post-op video or whatever it was I
Mhm.
watched recently, kind of little spoofy but fun, kind of makes post-op instructions fun.
Right.
Um, but I'm guessing that there have been a few patients that you've worked with in the past that, this was for them, it was life altering or changing, or maybe it, for you, it was part of the reason why you like being an oral surgeon.
Yeah, 100%. I mean, we were able to capture those stories through a company that I'm working with who put these really amazing videos together. And everything from, pan facial trauma patients that we saw at ECMC, to, people who, may have have, the terminal dentition who just need their teeth extracted and just were really great candidates um, for, implant treatment. Um, so those YouTube videos are definitely instrumental in how we communicate to the public in terms of what we're able to do for patients. And again, they're completely transformational. And we're trying to utilize that technology, which is not unique to our practice. Obviously, there's millions and millions of people doing that. But we're trying to do more YouTube type things, trying to create videos where patients can get more and more comfortable with our practice.
And I mean, I would say that's one thing that likely all of us are guilty of, is just needing to show people more of what we already do. There a lot of people do amazing things already. And I think that's what you're getting at, is that we're just showing people some amazing things we've been doing for years.
Right.
So I guess kind of wrapping all this up, and something else you mentioned earlier as well was like going around doing lunch and learns and other things. As a result of this, if there's any questions, people, the referring offices, their hygienists, their staff, if they have any questions or anything else, is there anything else you guys do that may help them be more confident or feel better about having these conversations or connecting the dots or anything else?
Yeah. So I think one of the really important things I want to get across here is the advancement in technology. We're not the only ones working on this as dentists. There's a whole team of engineers and computer programmers and all this stuff out there creating systems for the full arch treatment. And so, we work with various labs that have licenses with something called Chrome, which is really sort of a very nifty, sleek way of getting from point A to point B on either full arch fixed cases or full arch removable cases. And I think it's really important that our community knows about that. That's one of the things that I've been going around kind of talking to various dentists about. But it really does simplify the process. And it makes it very predictable, where we didn't really have that level of predictability in the past. Now things are quite different. And although, it's still an investment, but you have to understand that the predictability is so much higher. And, the end result that patients are getting are dramatic. So, I mean, if I were to sort of add to anything I've said before, is I really would want everyone to know that, we work with all of that technology. We work with the labs that have sort of the best stuff out there, and we're really able to deliver on that.
So it's kind of like going to a restaurant. We know that they got all the good kitchen equipment back there. We know that they got, that they got a great following, but the most important thing is the meals are great, just like your cases, right?
Right. No, absolutely. 100%. Yeah. So,
I mean, if the patients walk out and they're happy and they're smiling, and to me personally, if if it's a game changer for them, you know, if it makes them smile. And I know you and I have talked about some of these ones that have even made it around social media, and you see someone who, for various reasons, they've just neglected their teeth, or, you know, they may have had an addiction problem or something like that, and they, you know, they decide to make life changes, and, you know, the day of their delivery, it's pretty emotional, you know, and that kind of stuff, it's life changing, and it happens everywhere, and it should be happening in Buffalo.
That's right. That's right. 100%.
So, well, it's been great talking to you this morning. And, you know, if any of you have questions, if this has piqued more interest, or you have other questions, you're interested in Erica coming to your office, or just a quick, simple question, there will be contact information at the end of the video. If you don't already have it, it'll have you know, the web address and the email and so forth, that you'll be more than welcome to contact Niagara OMS. And other than that, it's been fun, and maybe we'll do another one of these one day soon.
Yeah, sounds good. It was pretty fun.
All right, awesome. Thank you.
Thank you. All right.